Hi, Dave. How are you?
Hey, good to see you.
It's good to see you as well. So I know the nurse told you about Dax. I'd like to tell Dax a little bit about you, okay?
Sure.
So Dave is a 55-year-old male with a past medical history significant for depression, type 2 diabetes, and hypertension, who presents today for follow-up of his chronic problems. So Dave, what's going on?
Yeah, I think every weekend this summer we've had house guests, and we're getting ready to help my son move apartments, and it's just been a very stressful summer, surprisingly so. And I'm really concerned about my blood pressure. I monitor it, but it's just been up the last week or so.
Yeah, we've had the same experience. We haven't seen anyone for a year, and now they're all coming back, and it's been a lot. I agree. It can be stressful. So tell me a little bit about your blood pressure. Is it elevated all the time, or how often do you check it?
For probably maybe the last 2 weeks or so, I've been checking it regularly in the afternoon, and it seems a bit higher than usual. So I was really concerned. Hence the appointment that I wanted to set with you.
Okay, yeah, I know we've kind of battled your blood pressure in the
Hmm.
past, and we have you on the maximum dose of the lisinopril, and so it sounds like it's still elevated. Okay, all right. So tell me a little about your depression. How are you doing with that? I know that we've kind of talked about that in the past, and you're on the Zoloft. You doing okay with that?
Yeah, for the most part, it's been a tough year and a half, obviously, and I go through mood swings. I'm a little concerned. I am still taking medication, so it's been under control for the most part.
Okay, and tell me a little bit about your support system. Who's at home with you?
My wife, we've got great neighbors, so I'm really fortunate. I do get to see the kids before they go back to college, so they've been there and very helpful, but for the most part, it's been good.
Okay, and work, how's that been?
Very busy, which maybe adds to some of the stress, but again, it's been okay and manageable.
Okay, and my last question, do you feel like you're going to be able to take some time for yourself in the near future?
Maybe after Labor Day.
Okay, all right. And then let's talk a little bit about your blood sugar. How are you doing with the diabetes?
I've been actually taking measurements about twice a day during the business week. On the weekend, sometimes I forget because I'm not home, I'm on the go, and it just slips my mind.
Okay, do they seem like they're within range?
For the most part, yes.
Okay, and you're taking your metformin?
Yes.
Okay. All right. Well, I know the nurse did a review of system sheet when you checked in, and you endorsed just some congestion from some allergies and the heat.
Hmm.
Do you have any other symptoms like chest pain, shortness of breath, abdominal pain,
No.
any nausea or vomiting?
No.
Okay. All right. So let's go ahead. I want to do a quick physical exam. Hey, Dragon, show me the blood pressure. Yeah, so even in today's visit, it is elevated 156/94. I guess you could be a little nervous, but let's go ahead and look at some of the past readings. Hey, Dragon, show me the blood pressure readings. Yeah, so they are kind of on the higher side, despite our titrating up the lisinopril. So we'll go ahead and talk about that.
Okay.
I'm just going to listen to your heart and lungs, and I'll let you know if I hear anything. Okay. So on your physical exam today, your heart does show a little 2 out of 6 systolic ejection murmur, which I haven't heard in the past. Your lungs are nice and clear. I don't appreciate any lower extremity edema, and there's no carotid bruits in your neck, which all sounds good,
Mhm.
okay? So let's go ahead and we'll look at some of your results. Hey, Dragon, show me the EKG. So here your EKG looks quite good. I'm pleased with that. It's completely normal, no signs of any coronary artery disease or anything like that. Hey, Dragon, show me the diabetic labs. So in reviewing the results of your diabetic labs, your hemoglobin A1C is a little elevated, but for the most part, everything looks good. So I do think overall you're doing a good job with your diet. But let's talk about it. I think we have to make some changes, okay?
Mhm.
So let's talk about my assessment for you. So for your first problem, the depression, let's continue you on the Zoloft. It sounds like you're doing well with that.
Mhm.
You said you're having some mood swings. Do you think you need a referral to psychiatry to talk to a therapist, or you think you're doing okay?
I don't think at this point. I'll consider it though.
Okay. All right. Well, let me know if you need anything. I'm always here for you.
Mhm.
For your next problem, the type 2 diabetes, I want to go ahead and increase your metformin to 1,000 milligrams twice a day.
Mm-hmm.
And I want to go ahead and order a hemoglobin A1C for another 3 months, okay? Hey, Dragon, order a hemoglobin A1C. For your hypertension, your high blood pressure, it's not controlled. We can do a better job on that. So I know you're on the lisinopril 40 milligrams. I want to go ahead and add some Norvasc 5 milligrams a day to help get your blood pressure under better control, okay? I also want to go ahead and order an echocardiogram to evaluate that murmur that you had on the physical exam. And I want to go ahead and order a lipid panel, okay?
Mm-hmm. Sure.
All right. Hey, Dragon, order a lipid panel. So the nurse is going to come in, she's going to get you all checked out, and she'll help you make those appointments. And then I'll be in touch with you through the patient portal with the results, okay? Do you have any questions?
No, that should be fine.
Okay, great. Hey, Dragon, finalize the note. This is good to see you, Dave. Let me know if you need anything.
You got it.
Take care.